It's developmentally appropriate. What I mean by that is it's unique for every child, knowing that autism is a very wide spectrum and it manifests in different ways. And so ESDM tries to identify what the areas where the child needs to improve, and then we work on that area. So it's appropriate, it's developmentally appropriate, and it's evidence-based. And there have been a lot of trials to show that ESDM is very effective in mitigating the symptoms of autism. So that's one of the characteristics. And then the second thing is the delivery. So ESDM is delivered in a very detailed manner, and the trainers go through very rigorous training, like I said, just to make sure you're delivering the model based on the fidelity. As a parent, if you feel your child has symptoms or your child has been diagnosed with autism, I would expect you to seek out information. If you're very interested in ESDM, our contact is here at the Mind Institute, and you can also go to the ESDM website, esdm.co. That's the website. And then when you get in contact, we will go through the process of drawing a curriculum for your child and interacting with your child and interacting with you as a parent, just to understand what your concerns are. And in that way, we can go through the steps of delivering the treatment if you meet the criteria. If your child has problems with social interaction, first of all is to find out what your child is motivated in or with. So if your child likes to play, the kind of play that your child likes, you have to engage the child in that play. So if it's a child that likes singing and dancing, so we choose the songs that the child likes Happy and You Know It. So we start singing If You're Happy and You Know It. And seeing that the child is engaging, you also make room for the child to engage. So I will sing Happy and I'll wait for the child to respond. And in that response, you can initiate some things. If the child has troubles with maybe responding to name, I'll pause a little bit and maybe call the child by name, maybe John, and see if he gives me an eye contact, because he's very motivated in the singing, in the activity. So we try to find activities that the child is highly motivated in and play. And in play, we teach. And we teach interaction, we teach response, because we know that children, the best way to communicate is through play. And that's why play is like the most important thing in a child's life, apart from food, obviously. So, and in play, so we teach interaction, we teach reduction of behaviors in play. And so ESDM is a play-based therapy, and finding the kind of play that the child is very motivated in, that's where we teach. And that's why we encourage parents to spend more time with their children and find out what really motivates them. And that's one huge step to success in ESDM. There are ways to improve attention in ESDM, and one of the ways we improve attention is to find out what the child, like I said, is motivated. And if it does 5 minutes and goes away, there's a way we call prompting. We can prompt the child to get back to the activity. You can change up. Maybe the child is bored with what you're trying to do. You can change up the activity to something motivating.